And welcome to another edition of the Natural House Call. I'm Dr. Z, and so happy to be with you for this Sunday morning. And just remember, you can always get in contact with me at Dr. Z Naturally. We have some up and coming fun shops like our trip to Chinatown, October 1st, and our herb walk with the natural nurse. You can also contact her, naturalnurse.com. But anyway, so we have an amazing guest on today for this program here, Dr. Ken Redcross, and he is author of Bond, The Four Cornerstones of a Lasting and Caring Relationship with Your Doctor. He's also founder of Redcross Concierge, a personalized medical practice designed to enhance the patient-doctor relationship while providing access to a full spectrum of healthcare services, including holistic and wellness counseling. Dr. Redcross was one of the first people to do concierge medicine, and he has an excellent portfolio with many athletes, professionals, and executives from all walks of life that he works with. And he earned his medical degree from Columbia Presbyterian Medical Center in New York, specializing in internal medicine. He participated in fellowships in Puerto Rico and Dominican Republic and is fluent in Spanish. And he co-founded Medical Stop, an urgent care walk-in clinic in California. And he's an advisor for Healthy Directions and also Biobotanica, herbal manufacturers, where I met Dr. Redcross. So, Dr. Redcross, welcome to the program.
Thank you so much, Dr. Z. It is wonderful to be here, and happy Sunday, everyone.
Yeah, okay. Well, tell us a little bit about your background and how you got involved in medicine and eventually you decided to get into concierge medicine, which that's many patients, listeners won't know what that is. So maybe you
Yeah.
could define that for us.
Yeah, everyone. So, it's funny, Dr. Z. They always say time flies when you're having fun. And I've been very fortunate and blessed to be in practice, gosh, 2 decades now. And so, like a lot of doctors out there, everyone, I started my medical training, as Dr. Z mentioned, in Columbia Presbyterian in New York. And that's my Western training background. But when I started practice, I started to see that medicine was changing a lot. Medicine was really starting to focus a lot on volume instead of value. And I'm talking about that value with all of you out here being able to really, as I like to say, Dr. Z, get into the soul of the patient. And so I started to see that changing. And it was around 2007 where I don't know. I'd kind of got to my wits end when I was like, I went to school all these years and I don't feel like I'm fulfilling not only my purpose, but the purpose of each patient that I was fortunate enough to see. So therefore, it was in 2007. One day, I'll never forget it, Dr. Z. A patient came in. She was so S-worded out. I don't like to say the word stress, everyone. I think that manifested, so I call it the S word. But in any case, she was only for this discussion a bit stressed out. And I said, "What's going on?" She told me, "Look, she works for Universal Studios, and there's this big producer that she works with who's really not doing well, but he's too busy to go to the doctor." I don't know what happened there that day, everyone. It was almost fate, but I said, "You know what? Tell him I'll come see him." She's like, "Really?" So I took my stethoscope. She later on, the end of my day, got me onto the into the office and to Universal Studios. I walked in there with my stethoscope, walked by everyone with cubicles. Because don't forget, everyone, this is 2007. This is a different time. And I walked in, I saw this executive, and he's like, "Yeah, who are you?" And I was like, "Well, I'm the doctor. I'm just here to check you out." So I went there, I saw him, and he was like, "Oh my gosh, this was amazing. I didn't have the time. You came to see me." And I always joke, he says, well, doc, what do I owe you? And I didn't know what to say, everyone. I said, $100. And he's like, $100. That's it. So he wrote me this big check, Dr. Z. So the point of this was I realized then I was once again happy and in love with medicine again. Forget about the check that he necessarily wrote. But the point is, I had a happy patient in front of me. I had a patient whose soul I was able to get into. We spent an hour and a half together just talking about what was going on with him and what's making him happy and this movie that he was doing. And so it caused me to really start my book called Bond, which focused on four things: trust, respect, empathy, and communication, Dr. Z. And that's what we were able to do in that hour and a half. So I started in 2007. Would this be a model that people really found valuable? I know I found it valuable just emotionally. Would other people find it valuable? And I was, once again, fortunate and blessed enough that a ton of people found it valuable. And so I grew that over the years from 2007 to kind of where we are now. So as you could probably hear, this job that I have as a physician is so much bigger than me. I mean, I really feel like I know why I'm here, my purpose, and I try to really make sure that each patient, that once again, I'm fortunate enough to come across and touch Dr. Z, really feels that same energy and healing magic, as I like to say.
Yeah, that's great because it seems like medicine is 180 degrees different from that model.
Yeah.
Can you tell us a little bit about the book Four Cornerstones of a Lasting Caring Relationship? You mentioned trust, empathy, communication. I forget what the second one was, but
Respect.
respect. So tell us a little bit about, because that sounds like and you're kind of going back to the old, the old days of medicine where, people made house calls and things like that. And it's funny, that's the name of this program, the natural house call.
Oh, that's even better because take it back even further. It's funny, everyone. If you could see me or in my car right now, I have my black doctor's bag because that's what I do. I make house calls. I always say my office is your home. And so you're absolutely right. And so, as I mentioned, back in '07 and even earlier in my career, I just kept feeling that something was missing. And so it allowed me to put pen to paper. And it's interesting, everyone. I don't fancy myself necessarily a writer, not as good as Dr. Z there as far as his writing and so forth. But I had to put my feelings on paper. It almost started as more of a journaling sort of thing about what made me happy today, what made my patients happy today. And that culminated in a book that, gosh, it took me about 10 years because I would pick it up and put it down, pick it up and put it down. And I put all those things together that I feel was really important to get to what I like to call the patient nirvana, a place to where the patient is almost floating on air because their experience was so, so good at that particular visit. And how can I do that and impart that? And so I started to realize those four things: the trust, respect, the empathy, and communication were things that were so, so important, really in life, everyone, but definitely for the patient doctor bond, as I call it. And so every time I'm doing things or we're having these discussions like we are, Dr. Z, I'm trying to make sure that everyone listening really says, gosh, Dr. Redcross may have a point. Am I getting all four of those cornerstones with my doc? If not, how can I get them? If I am, great, tell the doctor. We'd love to hear that. We don't always hear a lot of thank yous sometimes either, which can make a difference. So the whole point is like bond is it's my heart. It's where my focus is on each and every one of you. Just like right now, all of you listening right now, my focus is on you and your happiness and making sure that hopefully you're feeling some of these cornerstones right now while you're listening to Dr. Z and myself.
Yeah, I think communication is very interesting. I find that it's very difficult to in the medical model to communicate
Yeah.
effectively all the parameters of someone's well-being. How can you do that in a 5-minute office visit? I mean, what's going on with medicine today without being, overbearing and negative about it, but
Yeah.
where they have to see so many people, and how could you talk about the stress that you're or the distress that you're having on the relationship with your parents that's bogging you or whatever the issue is? I mean,
Yeah.
kind of.
That's a great question there, Dr. Z, because the reason why it's such a hard thing to answer, you're like, how can you do that? Because you hit the nail on the head. The average doctor's visit is about 7.5 minutes. Now, if all of you sitting there could think about 7.5 minutes, that's for me to find out how are you doing just in general. That's also, how was your daughter's wedding? I know you went to a wedding this weekend. How's that? Have you had your colonoscopy? So as you see, there's all these things that's on that list, guys, that's so, so important. And I find one of the best things to do, especially for all of you listening out there, is to number one, I talk to patients a lot about going to their doctor's visit as a strategy. Like, don't just make your doctor's appointment run in and run out. In other words, go with a plan. Go with knowing that there are three important things that you would love to have answered at that particular visit. It keeps you focused to make sure that you leave once again feeling good. And number two, so that the doctor also is able to focus as well on those specific things so that he and she can also make sure that you've attained the sort of visit that you want to get to. Now, for me, your question earlier was about concierge medicine, Dr. Z. And so, concierge medicine, everyone, it's just a different way. Like I told you, I make house calls, I'll do video calls and that sort of thing. But it allows me to take as much time as necessary with all of you, to really get to the bottom of what's going on. And so the way I was able to kind of, like you said, without even being negative, but for it to fit who I am and what I felt my mission was, I was able to pull back and say, instead of seeing 30 patients a day, what if I saw 10? What could I really do and impart in their lives if I can cut my workload down a third? And how happy would they be? So for me, it worked out, Dr. Z, to where I was able to kind of carve out a little bit more of a niche. But for some of you out there who may not have concierge doctors near you, or it's not usually in an insured model, even though it's become a lot more affordable, this is a time that once again, you go to your doctor's visit, but you go with a strategy, with a plan of the things you want to know. Maybe one of the things I give some little hints and tips: make the first appointment of the day. You know why? The doctor's on time and he or she is bright eyed and bushy tailed, ready to listen and go. Also, you can call the nurse before you get there. Hey, it's Dr. X. Is he running on time? Is she going to be all right? Should I come in later? Should I reschedule? Or can I have a 30-minute slot? See, these are things that you can all ask for to make your doctor's appointment a little more active, a little more engaging, and so forth. So there's a lot of little nuances that can make a difference.
Yeah. What about the effect of people? Are you finding that people are not doing enough stress management and they
Mm,
need um, advice from you, or an understanding or direction from you is a better word for
yeah.
how to manage, because stress is always there, like it's always there in life, but it's kind of in the eye of the beholder, I think.
Yeah, yeah, no, that's a great way to put it because it is. We all manifest it differently. That's why one of the bigger things, and look, that's a big part of what I talk about in the practice. And I think when we come together, that's one of the big things that I usually start with because it can manifest itself in so many different ways. It can manifest itself with a young woman in front of me who's having a hard time getting pregnant. It can obviously manifest itself as a gentleman that comes in and he's getting chest discomfort. That's the one that we typically know. So when we talk about this is why I always talk about three important things for our life experience, which is nutrition, movement, and spirituality. Now, spirituality, everyone, here I'm not talking about anyone's particular religion. Spirituality is pretty much how you deal with your S word or your stress, as you mentioned. And so now we talk. Now, Dr. Z, you are a master karate champion. So for you, that's that way where you can actually de-stress. In other words, it's finding something, everyone, that I always say is yours. Something to where you can kind of get behind those four walls, and kind of have something that only you own and you are kind of left alone from that outside world. See, we are so plugged in no matter what, right? An alert on our phone, we get a call, whatever it is and what we're doing with our job. So when you talk about managing that, number one, it's about acknowledging those things that cause that S word or that stress and trying to make sure that those are kind of ticked off your list, but also taking time for you. I tend to find that that's a big thing that we talk a lot about. And when you're able to really, really do that, you start to realize that maybe some things don't necessarily belong in your life right now. And maybe certain things, more things need to be in your life that really focuses on how we manage that. I also find that, exercise is a big, big component of that. And exercise is interesting. I don't want to, you could turn people off, Dr. Z, sometimes when you talk about exercise because they're like, look, I don't want to lift weights. I don't want to do anything strenuous, but I get it. I talk a lot about walking. They've done so many studies that one reason why the Mediterranean diet may be better and the longevity is better isn't just the food. It's the fact that after they eat, what do they typically do in Europe, everyone? They go for a walk. They go for a simple walk. And the study showed that, believe it or not, with me in that gym, because I'm a big fitness guy, was equal to that of someone walking at a little bit of a brisk pace with their arms moving back and forth. So it didn't have to be strenuous, but once again, it can be something as simple as walking and something that's absolutely yours to really help manage that.
Yeah, that makes sense. And also possibly combining it with things you like. Like for instance, a lot of people like music, but they don't have time to listen to it. So now you can listen to it as you're exercising.
Yep.
So that you're combining something you love with something you, well, it might be okay. And that
Right.
might be a good marriage.
Yeah, no, you're absolutely right because everyone is interesting. You'll hear myself and you'll hear other docs, you'll hear everyone talk about it. But what really is life about when we're dealing with stress? You know what it is? It's balance. It's really about balance and how to keep that balance. And you'll recognize that certain weeks are better for you when you really have had that balance of a ton of fun, or you've been able, for me, I like to check the box for my to-do list. That brings me joy. And you realize that that balance is there when you have those weeks where you're able to check that box or get things accomplished versus everything having to be focused on work and things that aren't necessarily, as I like to say, fulfilling as some things that you want to do.
Do people like house calls? Do they like the old time? Do they feel like they could share more than being in the kind of the more sterile office? What's your feelings about that, Dr. Redcross?
Yeah, I'll say they don't like them, Dr. D. They love them with a capital Love. Look, everyone, look, there's nothing more comforting than coming into someone's home or having the doctor come into your home. Right there, that relationship or that bond, as I told you, the name of my book, is created immediately. I always say the first time you make a house call, you have a patient for life, because that patient almost in a sense becomes almost like family. I've gone to certain houses and you smell like something is baking for you or something. It's just awesome, right? But the point is that when you get there, there's so many different things that I see. I have a patient who has asthma, and she, no matter what, when I was in that typical office environment, I can't get a hold of her asthma. Well, I go home, everyone, and she has 3 cats and a parakeet. All of those things are highly allergenic, but those are things I couldn't see without a house call, right? I wouldn't have normally in my medical exam say, hey, by the way, do you have a parakeet or do you have, it just wouldn't have been a normal part back in the day of that 7.5 minute visit that we had together, right? So when you make that house call, it creates a perfect bond, a perfect marriage in a sense of that patient nirvana, as I mentioned before. So now, obviously, it's a challenge, right? I'm one person, I'm one doc. I can't see the world like I wish I could, but COVID didn't have hardly any good consequences, right? 99.9% of COVID was horrific, but that tenth of a percent allowed us to be able to do video consultation, video connection, some things that we never would have thought about as much at the time. But as far as the house call in and of itself, I mean, it's magic every time you're there. You really are. You're there, and you're really just creating so much relationship, and so much connection there, which is something that we talked about. Medicine has changed a lot, and so a lot of that is lost, and I think that's why so many patients aren't necessarily so satisfied right now.
What about empathy? Well, that's part of your cornerstones of working with the patient there. What are you being empathetic about?
Well, it's funny. We're changing as a world in some good ways, and one of that I'm talking about like mental health. Right now, mental health isn't that negative stigma that used to be, or you have to keep it hush hush and quiet. And so I mentioned that because when you think about empathy, when you pull out the word is pretty much feeling someone else's feelings at the time and what that means. And so that was something that I think we started to lose a bit as well. And even in healthcare, I don't think it's done purposely. I just think it's done with that volume word because it's so busy to really pull out and say, I have a scared patient in front of me. I have a patient that's here for a reason. It took time to make an appointment, waiting in the waiting room for an hour and a half to see me. And they're here because they have something that they're concerned about or their loved one is concerned about. And so empathy is something that make sure I bring at the forefront. I mean, obviously, it's great. You see me as a doctor. I'm pretty well trained. You can say my IQ is good, but it's that EQ is where I'm feeling is once again where the beautiful kind of magic happens is when a patient really truly and feels like, it's crazy, but this doctor, I really feel he cares. I really and truly feels he cares about me. And so that's what I try to exude. Even as we're talking on the radio, everyone, we can't see each other. We can't, what they say, press flesh with a handshake or a hug. But I hope you can actually feel that, while we are here together, that, I care about what I can impart, whether it's education or support or direction. So empathy is a big part and probably out of my cornerstones, one of my favorite ones because it almost encompasses everything. But it's who we are as people to feel empathy for one another.
Yeah, it's a very holistic model you're following without actually, calling it holistic
Mhm,
medicine in a way. Holism is looking at all the aspects of a patient that play a role in their health, whether it's their relationships with their family, their relationships with themselves, their relationships with food, or relationships with exercising,
mhm,
their behaviors. So that's one aspect. That's the whole holism model. What's going on with their, what do they think? Like Buddha said, you become what you think about all day long.
mhm,
Well, then
mhm,
you see a person that's sick in front of you, you wonder, wow, what are they thinking about? What's their life like? What's their, how can I figure that out? So that's what I see as holism. Do you have a definition of holism or holistic?
It's funny. I'm glad you said that because, it's funny, everyone. As I mentioned before, I'm a Western trained physician, right? And this is a much kind of different world than what we're talking about. And even the world that you live in, primarily, Dr. Z, is that, over the years, everyone, I sort of evolved. I evolved when I finished at Columbia and I went out to California. I worked with migrant Mexican farm workers for 4 years in the strawberry fields. And I later switched my practice to a different part of Los Angeles, but it was there for that holism that you're talking about and that question where I started to see people that were getting better without my prescription pad. In other words, they were doing some things spiritually. They were doing or taking some things, whether it be homeopathy or herbs or tinctures and things of that nature that I hadn't been exposed to in my Western training. And it was there where the light bulb really came on for me. In addition to, I mentioned when I did that first house call, it married so beautifully because that sort of medicine or practice really requires a lot of holism, a lot of oneness, a lot of naturalness, right? And a lot of different kind of buttons are pushed that are very special and unique for each and every one of us. So when I think about that wholeness or that oneness, it's like I have my Western medicine hat on one, and then I have a very holistic hat on the other side, probably bleeding more over to the Western side that I ever thought possible. But that for me is what brings that uniqueness and oneness together. Being able to kind of take the hat off and on, and be able to use my education from the Western side into some of the spiritual side or the more that I always say that's a little bit closer to the earth.
So doctor in Latin means docere, means to teach.
Yeah.
Sounds
Yeah.
like you're quite a bit of teacher, and with the concierge model, you're able to teach, be the teacher that the word doctor really means. Can you tell us a little bit about your philosophy about teaching people about, like, how to live, how to be healthy? Because there's no one's ever taught us that. Maybe you saw that within the that model that you saw in California, possibly. But doctor means teacher. That's my, so not only was I a professor for 25 years, actually at a medical school, right? That's,
Mhm.
teaching, but every day I'm teaching patients about certain things, right? About health and wellness. And It's a liberty, like the
Yeah.
Rastas say, you live it.
Right.
Liberty, you know. So tell us a little bit about your philosophy of teaching people.
You know, it's funny. It wasn't until much later in my career when I realized exactly what you're saying, Dr. Z. I go in there, I'm the doctor, I'm there to diagnose, you have your strep throat, you have your hypertension. And it really wasn't until much later in my career that I realized exactly what you are saying, that I do a lot of teaching.
Mm.
I do a lot of that, but I never thought of it as teaching per se. This was my knowledge. I'm just trying to make you feel better, but I didn't recognize that my word could also leave and stay with you past the four walls when you walk out, which is exactly what a teacher does. And so I've been able to focus on those things I mentioned to realize that life is really about nutrition, movement, and spirituality. That's what it is, Dr. Z. It's a balance up and down of each one of those things. I always say that by birthright, we're all supposed to be able to get 120 years. The reason why I say that, when you look in different religions, and this, like I said, guys, I'm not necessarily an over religious person in this way, but when you look at, Christianity, supposedly Noah mentioned 120 years, and then you look in Judaism, and there was a 120-year reference again, and even when you look at the Quran, they talk about life begins, I think, at 120 days. My point is that 120 is something that I always talk to patients about, to say, look, I'm here to help you get your 120 years. And how am I going to help you do it? I'm going to help you do it two ways. I'm going to make sure the nutrition, movement, and spirituality is there, and that the bond is there as well, to marry those two. Because if you have the good doctor patient relationship, that's going to be important to make sure we find things early, manage things early. And then the nutrition, movement, and spirituality also helps me take care of you while I'm not there. And teaching about each one of those things can be really important.
So one interesting advantage that you have visiting people's homes, and you talk about nutrition being a cornerstone, is uh, you could kind of eye around and see, what's
Yeah.
in the shelves there and
Yeah,
what.
yeah,
So unfortunately, we have, a lot of people that live in food deserts and they just don't have
yeah.
vegetables to eat and healthy foods. But nutrition is a cornerstone. So tell us a little
Yes.
bit about your philosophy about good nutrition and how you help people with that.
So, the nutrition aspect is unique. As I mentioned, I fancy myself a pretty decent athlete. And so I do a lot of balance in what I call 20/40/60. Everyone. 20 grams of fat, 40 grams of protein, and 60 grams of carbs each and every day with each meal. So 3 meals a day and a snack. The reason why I talk about that in particular is it gets back to that word I mentioned before. It's balance. For me, for instance, in my training, when I balance those, I feel better. I feel livelier. I get to my metrics that I want. I share that with patients, whether they're diabetic, whether they have heart failure, whether they have hypertension, because that really gets that balance of what can I talk about, for instance, for that 20 grams of fat? Well, they're healthy fat. It's going to be a nut butter. It's going to be an olive oil. Once again, akin to that Mediterranean diet, nuts, seeds, some of those things that we can talk about how to balance that kind of 20/40/60 that I like to tell patients about to get that nutrition balance. And with that, I also talk to them about the importance of supplementation. Our foods aren't the way they used to be necessarily, right? Unless you're fortunate enough to be a part of a CSA, or you're fortunate enough to be able to grow your own food and so forth. So supplementation becomes a big part for a lot of us to kind of fill the gaps, in addition as well. But nutrition, once again, it really comes from balance, not to necessarily to ascribe yourself to a paleo or a keto and all that. I find that that gives patients a lot of angst lots of times, as opposed to kind of understanding what a 20/40/60 can look like on your plate. And it doesn't mean that you can't enjoy yourself sometimes, but it's really important, especially for my patients who have blood sugar challenges.
Yeah, we'll get into that. And now that we're kind of into the out of our introductory phase of the program, if you're just joining us, you're listening to the Natural House Call. I'm Dr. Z on WPKN Bridgeport 89.5 FM, listener sponsored free speech alternative radio, and streaming on the web at WPKN.org, the station originating out of Bridgeport, Connecticut. So we're here with Dr. Ken Redcross. He's a very interesting, that's for sure, doctor, really a crusader, I think, with the founder of Redcross Concierge, personalized medical practice, which enhances patient-doctor relationship and gives access to full healthcare, but makes it convenient for people, and offering holistic and wellness as well. So Dr. Redcross has written a great book, Bond, the Four Cornerstones of a Lasting and Caring Relationship with Your Doctor. But we're going to change gears because he wanted also to talk a little bit about Dr. Google and TikTok doc. It's interesting because I'm not really a big social media person. I don't really
Right.
get, I have other people, that I have that handles that for me
Right.
and other things like that. But you mentioned in the introduction there, a doctor's biggest competition used to be Dr. Google. I guess we could talk about what that means.
Right.
Now it's the TikTok doc. The internet and social media can be convenient and useful for many things like restaurant reviews, vacations, and things like that. But when it comes to health tips, following the advice of these influencers who are TikTok docs could lead you down the wrong path. And it's kind of interesting because that generation probably doesn't listen to my radio program here on a real radio station. We
Right. Right.
are podcasted, and we do have, people can get onto archives, but a lot of the young people don't tune into radio anymore. Now, myself as a professor emeritus of botanical medicine, and I taught phytochemistry and phytopharmacology and things like that, I have concerns about the TikTok trend of telling people to do kind of these crazy things with herbs and what they call hacks.
Yep.
And it doesn't talk about the true understanding behind the botanical or its toxicology and history and drug herb interaction. I know you and I both are involved with mentoring various supplement companies, but here we have something that maybe can help or harm the public. So what's your tell us a little bit about social media, and for those, because we have some listeners probably on the radio program there that don't do TikTok or things like that. They probably look up things on Google, but they probably don't do all the social media things. So tell us a little bit about that. Are they helping or harming the public?
So Dr. Z, that's such a good point. Dr. Google, everyone. I mean, we kind of joke and call Dr. Google, and that was when we used to just kind of just Google, see symptoms, think that we all had it, and said, "Oh my gosh, I'm not going to be here any longer." TikTok Doc is a little different because TikTok Doc is almost giving more advice directly to like the world that usually isn't correct. But just like you mentioned, I'm a positive guy, right? So I'm never gonna like come down hard. But what I will say is this: I'm grateful to TikTok Doc for one reason in particular. And sometimes they'll bring up some things that are usually very, very wrong, but they bring up topics that we never would have been necessarily talking about. One of the bigger ones you'll see, everyone, is this kind of craze with Ozempic or Wegovy, which is a medication that's helpful for blood sugar, everyone, or for diabetes treatment. But it got what there was a natural herb that sort of got roped into that called berberine, which I know that Dr. Z is very familiar with as well. Now they started calling berberine nature's Ozempic, intimating or implying that if you start taking all this berberine, that you're going to start losing all this weight. So I'll come here to correct a couple of things. Number one, berberine is fabulous when it comes to helping to support blood sugar. That we know. We know it's also fabulous at helping to support cholesterol as well. Now, there are some studies out there that potentially berberine could be sort of supportive to help with the waist circumference, things that are related to weight management or weight loss, but not enough to go under the feet to the fire to say this is something that should be added for a weight loss drug. So this was a perfect example of when TikTok went crazy, but kind of got it wrong but we wouldn't have been talking about berberine had they not gotten it wrong. To realize that there are some things like berberine out there that can be really supportive for your mom, your dad, or yourself if you want to add a complement to help manage your blood sugar with the help of your doctor. That was the other thing that I talk about with these TikTok crazes. There is no one size fits all. So as we talk about berberine, even now, there should be a discussion that happens with your doctor. I know Dr. Z obviously is familiar as well. The research studies that I've seen are for 1,500 milligrams. I talk to patients that when you look at your berberine, there are some good berberines out there, whether they're one that includes chromium, includes cinnamon, or the banaba leaf, which is a leaf in Eastern Asia and the Philippines. So these are things that you want to look into, learn about, and look at that when you look at your berberine. But the point is that this is a beautiful discussion that TikTok Doc brought up by mistake, but we just have to dispel some things. And that's kind of the weight management aspect. That's not the beauty, the full beauty of berberine.
Yeah, I mean, it does a lot of things, but being that it's a very strong
Yeah.
alkaloid,
Yeah.
there's questions. I mean, so is caffeine. Caffeine is an alcohol. Anything that ends in an INE, I remember teaching my students. So nicotine is an alkaloid, caffeine's an alkaloid, morphine is an alkaloid, ephedrine is an alkaloid, cocaine is an alkaloid. So alkaloids are like the heavy hitters of the herbal world, but
Yeah.
they have to be used. There's questions like, should you be using these all the time? They're not.
Right.
Caffeine gives you some energy because it helps your body release stored sugar and releases a surge of adrenaline and whatnot. But it's definitely not tonic to the adrenals. It actually drains them over time. So you should always. I was going to say you should always use botanicals under the advice of a physician, but the problem
Yeah.
is many physicians aren't
Don't
trained
know.
in
Yeah.
berberine.
Right.
I,
Right.
I don't know how much herbal medicine you took at Columbia Presbyterian. Probably not a lot.
No,
No,
no, not a lot at all.
being a naturopathic physician, of course, that was a huge part of our training. Over 1,200 hours of botanical medicine in the program. I went to Bastyr University out in Seattle.
Mhm.
And then, but so that's what I see as a big problem.
Mhm.
Red Cross is that, and then you read, and then the people who can afford the highest Google hits are often people who have no knowledge of prescribing berberine. They maybe come from academia. Maybe they looked it up on the internet. Maybe they're a hospital website. Maybe they're an allopathic medical website. Again, no experience prescribing these herbs and just basing it on some research studies and not really
Mhm.
it's not a liberty, like I said. They're not
Right.
doing it every day and looking at, okay, well, are there any negative interactions with berberine, or what can happen to the body? So anyway, it's just it's very interesting about this, how the TikTok thing has unearthed this about the berberine there. I think it could be used properly, of course, as a holistic management thing for diabetes. I know that's something that you don't want to dismiss the like you said, all the stuff that the social media has unearthed about
Right.
berberine, but you want to be able to use it properly. And so those are some of the things I've seen. And then of course, golden seal is kind of an endangered species,
Mhm.
which is where they get a lot of berberine from. Although
Yep.
they do get it from golden thread, which is a Chinese herb that's
Mhm.
like the Chinese equivalent to golden seal. And then a big tree, that they get also berberine from, which is kind of a cousin to the oak tree in China. So they can get it from a sustainable, because I always think about sustainability too. If everyone starts taking berberine, what's going to happen to the little golden seal plant?
Yeah. Yeah, yeah, no, and I appreciate it. And one of the things, like, as you talk about this right now, Dr. Z, this is the beauty of what I mean about medicine and about learning and educating yourself. So here we are. I'm talking about the TikTok doc part. I'm telling you that at least we've brought up berberine and we've talked about things. But that's why I love being on shows like yours, where they provide such a wealth of information, because here I go talking about berberine with a certain layer, and it's beautiful because then you come with an even deeper layer to educate again, which now, as we talk about berberine, also provides me with more to share. That gets back to the doctor piece and teaching
Yep.
about that and those specifics like that. So that's why, like I said, I was so excited when the opportunity came to be on the show with you, because there's always a wealth of information that comes from it.
Yeah, it definitely kind of shuttles the glucose out into the periphery for your skeletal muscle to burn it, which is a very interesting new class of diabetes drugs. Are kind of doing that with what they call PPAR, as I recall. So it
Mhm.
kind of shuttles the sugar to the skeletal muscle, and then you're into fitness, getting your patients more fit that have
Yeah.
diabetes or insulin resistance. They could certainly benefit from that. The other thing that's interesting about berberine that I've seen, Dr. Redcross, is it seems to have some good impacts on the gut flora. And there was an
Mm.
experiment about 10 years ago where they took identical mice and they put the human flora into the mouse. One was a diabetic, type 2, and one was not a diabetic. And they found that these identical mice, right? The one that got the flora, and by the way, they were fed the same diet, right? Too, so to keep
Okay.
control. And when they put the flora of the diabetic person into the mouse, that mouse went on to develop type 2 diabetes. So that
Mm.
got the researchers looking at, wow, what's going on with the gut flora of a patient with diabetes, and is berberine actually impacting the gut flora? And so I did I was at a conference and I did a deep dive into that with because I was talking about gut flora and weight, that
Mhm.
there's a
Mhm.
relationship between
Right.
mass index and the patient's gut flora. And that's where, we've heard about fecal transplanting with people with
Right.
very severe digestive problems, Crohn's and colitis. And
Crohn's in particular.
yeah, so I mean, that's another whole dimension of berberine that's very interesting.
No, you're right, and exciting, right? We've learned so much about the gut over these past 10 years. We learned about the brain gut axis, but here is, you're right. What if somebody like yourself actually in your lab does a deeper dive and really brings much more light to what berberine can do in the gut, and for other ways or mechanisms to help in the support a better blood sugar level, whether it's postprandial, meaning after eating, or just when you're resting as well. And so I've seen those things as well. I've even seen some studies that talk about a potential interaction with the GLP-1, which is a hormone, everyone, that helps to deal with satiety when we're full or when we're not full. Once again, back to that gut. So very fascinating stuff around berberine, which once again wouldn't have kind of come out without TikTok doc. But as we're talking about this, everyone, you see it's a little more complex than just an influencer getting up there telling you guys to go out there and take a lot of X or not. There's an education around it as well, about what these things can mean for your health overall, which is the reason why you have to rope in a doctor, or someone who's also specialized in this world, to really make sure you understand what you're doing for yourself.
And then you mentioned in some of your literature that you want to look for berberine supplements that are from reputable and trustworthy manufacturers, because you can go looking for a zillion things on the internet and it may not be pure or of good quality. So that's another
Oh
whole
yeah. Yeah, this is where I get to the point of everyone, whether we're talking about berberine or something else, you want to look for seals, right? Everyone, like those little seals. Those seals are important. One of the big ones to look for are the ones that are GMP, good manufacturing practices, for instance. And those seals are bigger than the company itself, everyone. It's a third party that comes in to make sure that things are on the up and up, that things that are in your bottle that they say are on the bottle are in the bottle. That's the key as well when you have a third party kind of designee to make sure that everything is okay and that the quality and the effectiveness is actually there. So you're right. It's so important to figure out where you're getting your supplements from, and to make sure that you, as a consumer in this case, know what sort of certifications and seals you should look for.
Right, because there's, when you get things from possibly overseas and they haven't been looked at, there could be heavy metals and contaminants.
Right.
Even they even have been shown in certain countries to spike herbs with drugs.
Yeah. Yeah. Can you
You know,
believe that? Unbelievable.
so there's all kinds of things that we can. Yeah, so that's interesting about. So are there other things on TikTok as far as you're looking at these influencers that have been really bad influence? So
Well,
look at that too
You
carefully.
know, it's yeah, it's a good question again because, once again, everyone, they were talking about berberine in that case to hopefully help with, they thought, weight loss, but we've talked about that. Once again, didn't mean harm. These other couple of challenges, for instance, there was one called the Hot Girl Walk Challenge. This was about a young lady who was quarantining from COVID and wanted to go out and take a brisk walk. And she wanted to focus on some things which I love, right? Positive goal setting, focusing on the importance of being grateful. The third thing she wanted to focus on is reminding yourself how hot you are. And that gets back to like just practicing a little bit of self-love for oneself and the support that sometimes we don't necessarily give ourselves. But the point is that I enjoy the fact that she wanted to go out for a brisk walk. But this is a discussion that, once again, kind of requires a doctor's intervention, right? I have certain patients, whether they're older, we talk about some people who may be listening to the podcast and so forth, maybe a little bit older. Well, I don't want my 90-year-old necessarily running out there until I know, like, hey, what is your footwear going to be like? What's going to be far enough or not far enough? We need to have some parameters around those things so that I don't hear like Miss So and so went out to go on this brisk walk and fell and hurt herself. So, once again, I love the fact that this particular influencer talked about those three important things. I love the self-love part. I love the feeling grateful, as I think we all should, and setting positive goals. But you still should come back to your doctor and say, hey, I heard this new hack. What do you think? Is it good for me? What if I have a patient who has a pacemaker that's in? Okay, I need to just be aware of what we're going to do for an exercise regimen or that sort of thing, instead of just following these influencers willy-nilly and not letting the doc know that you're going to go out and do some things that are a little more strenuous, so I can help you devise a even better plan that's tailored just to you.
What's some general advice you can give the listeners if they're trying, now it's getting to be fall, it's getting a little cooler, people
Mhm.
that have put off their exercise. I did a whole show a couple of weeks ago on how to combat delayed onset muscle soreness. That 48-day. Oh my God, what did I do?
Right, right.
I talked about herbs and amino acids and arnica and natural things to prevent that. But what should people be doing as far as should they be exercising and then taking their pulse to make sure that they've hit a target range? What's your advice? You're into fitness and things like that. And we don't talk enough about fitness on the program. We're always talking about vitamins, but we should talk about fitness, I think, too. I think that's really important.
Well, I'm glad you brought that up, the delayed muscle onset of soreness and so forth. Me, especially as a cyclist and so forth, I get that all the time. And so I'm glad you mentioned arnica. And there's so many beautiful things on the herbal side and vitamin side that really, really do make a big difference with that particular show, which I'm sure you highlighted. One of the things I talk about with everyone is, I mentioned earlier that even a nice brisk walk can equal that of what someone gets in the gym. So the first thing is to recognize that, hey, walking's enough. Tai Chi is enough. Some of these things are fine. And just remember that everyone's exercise looks differently. What we do know is that from the CDC numbers that we tend to do better as far as reduction in our mortality, everyone. In other words, keeping us on this earth longer if we are doing 150 minutes of exercise a week. That averages about 30 minutes a day for like 5 days of a 7-day week. So you can figure out how you get that with a brisk walk and so forth, but that gives you and your listeners a little bit of a measurement as to what that can look like for 30 minutes of your day, 5 out of the 7 days for the week. For those who are a little more, want a little more vigorous exercise or want a little more, that can be decreased to 90 minutes a week if you are really able. 90 to 75 minutes a week, I should say, rather. I'm sorry, 75 minutes to 90 if you're getting in a little more strenuous exercise. So those are some sort of metrics to look for. But once again, it doesn't have to be over the top. And then with that,
Hmm.
I also like to bring in, like I said, back to a little bit of a spiritual component. When I do a lot of my cardio, I like meditations, guided meditations. I like listening to nature. When I'm writing, I like being out in nature. So there's a lot of different ways you can balance around exercise that can be simple for you, and quite frankly, there's a way to make exercise fun, also as well, which really the studies show makes you really adhere to it and continue it.
So yeah, I mean, you're doing it a little bit more low tech than, getting a target heart range and,
Yeah.
220 minus your age times 0.75 or whatever the formula is.
Yeah, that's to get that goal heart rate. Those are things like, for instance, I know in my exercise, but it's something that can really turn people off a lot. And really, I found can be very discouraging sometimes when you don't hit that. And it's not supposed to be work. I want exercise to be play.
Well, there,
Um,
I
so
think,
that's why.
I think that neuroassociative switch is very important. Make it play and not work because people avoid pain. I mean,
Yeah, we try to, right, Dr. Z? We try.
that's where we're designed to avoid pain. So that's why I mentioned kind of combine some pleasurable things like listening to music, or you said nature sounds with your
Oh
exercise.
yeah. Oh yeah.
Maybe how about a buddy? I think that's I
Oh,
need
huge,
a buddy.
huge, huge.
I
Yeah.
for me it's actually the dishonor of not showing up to the dojang.
Yeah.
Honorable when you're a higher level rank, and it's an expectation and you don't want to
Yeah.
let the master down.
That's right, because 'cause you're supposed to set an example, Dr. Z.
Yeah,
So that's why, and then you're
don't
right, that
that.
buddy system works.
Yeah, people need leverage on themselves. I remember Anthony Robbins would always say, you got to get some leverage tool to get you off the couch and get you to change. Do you find that people just become copacetic and they want to change, but they don't know how to? You talk about mental health. How do you get people to switch it in their mind, like switching a radio station from one station to the other?
One of the things I talk about, it's one of those things we like when the holidays are coming up, and what do? The first thing that everyone does for the New Year's resolution is I'm going to get in the gym and I'm going to exercise and do all this, that, and the other. And they always show, usually it lasts a couple of weeks before things change. And it gets back to that same sort of way when we don't have to eat the whole pie at one setting and really just start to say, maybe I can just do this. Maybe I don't need to start at 5 days a week of my exercise. I tell people seriously, I just want you to get that one day in because I find out it's that one day, really, Dr. Z, that's the hardest. It's that one day to get that time. And then what I typically find is that after that one day happens, then they typically can do that one day, and then they were like, I'm surviving. I figured out how to get it in my schedule and on my calendar, as opposed to even 3 days a week. I'm going to get in here and do that. Nope, we're going to take baby steps. That old mantra they always say, how do you eat an elephant? And I'm a big animal lover, so please don't take this the wrong way. But you only do that one bite at a time, right? It's a big issue. It's a big thing you want to deal with, and you do it one bite at a time, and you can complete that. And so I usually start day one.
So it's like the old inch by inch, it's a cinch, but by the yard, it's hard, that old
There
motto.
you go. I love it. I love it. Absolutely. Perfectly paraphrased.
Now, you also wanted to mention, as we get to the kind of tail end of the program here, a little bit about hydration, because
Oh yeah.
uh, that's a very important thing. And you mentioned that there was this hydration hack, um, the water chugging challenge. Now that
Yeah.
doesn't sound
Scary.
like a good way to deal with the water. What's
No.
the way that we should really, it's still the tail end of the summer. It still is fairly humid out there. What are some things that we can learn about keeping our body hydrated? And how do we know when we're dehydrated? Most of the nation is roasting. We've been lucky this summer so far on the East Coast.
Yeah. Yeah.
I think we're going to break a record in August without a 90-degree day. That's pretty remarkable.
Wow.
But yeah, I was watching the weather, and but places in the Midwest, my have family in Denver, they're roasting out there. Family
Hmm.
in California, they're just
Yeah.
roasting. So, what about hydration?
So look, this particular challenge, everyone, and this is a really really good example of something that seems so simple that you get from a TikTok influencer, and you're like, oh, that has to be not a big deal. Well, water chugging challenge is a very very big deal, everyone. The reason why I say that, so this particular challenge, it says as the name states, it's just trying to chug as much water as you can in a short period of time. The problem is our body doesn't like that, everyone. We have sodium in our body that's very important for everything. And when there's too much water, you get dilution. And when that happens, you can have issues, I mean, specifically to the brain in particular, that can be fatal in some cases. And so, unfortunately, you saw some that did have problems that required hospitalization. But when you look at water, look, our bodies are primarily water, 60% water. And, we go through these sort of things saying, 8 glasses of water 8 times a day, which is about 8 ounces, is kind of the sweet spot to make sure that we're hydrating. But there's two different kind of caveats to that. Number one, if you are an older person and you're getting that much in, or you maybe have heart failure, I talk a lot about water restriction, which is that thing to get back to your doctor to talk about, where I want you to do everything opposite of chugging the water. I want you slowing up your water intake. Or for those who are a little more active, or some those who are athletic and so forth, I don't want you to hurt yourself by not hydrating enough to where that 8 by 8 is not enough as well. But once again, starts a discussion with your doctor to figure out what size fits you, because one size doesn't fit all. Dehydration is a big thing. Dehydration is something that we can tell when you have someone who's coming in, they're lethargic, they're tired, they're fatigued. You can even look at your skin and kind of do what we used to talk a lot about in the hospital, called tinting, when you lift the skin up a little bit and it stays up because there's not enough fluid underneath the skin and that sort of thing. So when you talk about something such as water balance and chugging, the last thing I want really any of you doing is chugging. But it does, once again, the TikToker did bring up the importance of maybe we should have a discussion around hydration. And that's exactly what we're doing now because of it. We're just making sure we're doing it correctly.
Yeah, I remember reading about this researcher at the University of Washington who discovered another structure of water called structured water, or I forget that he called it something else, I remember. And it's basically the water that we find inside of plants. And
Right.
that's a really good source of water, and it
Yeah.
seems to be better to hydrate your body than actual water. I'm not knocking water. I think it's important to drink it regardless of what the structure is. But the structured water from plants had super duper hydration power. Like say you were to drink some celery juice or parsley juice or something like that.
Yeah.
You ever hear of that, Dr. Redcross?
I have, and I'm glad you brought that up because, even as we're talking about chugging that water, we're talking about just regular water. You're right, Dr. Z. There's a lot of that in our diet for celery or other foods that already have a good amount of water. So that's not even added in the chugging aspect of it. There's a dear colleague and physician as well, had a book called Quench, is Dana Cohen. where she goes into just that, just into like how is all these foods that can really quench our thirst, and really do some big things when it comes to hydration. So that is a very, very good point that you bring up. And once again, I didn't even include everyone in that particular challenge, which obviously that TikToker didn't include in that challenge as well.
Yeah. Yeah, actually, we had her on the program, I believe. We had
Oh,
author
good.
Quench. Yeah, that's where I learned about it, and I started doing my own deep dive into it. So yeah.
Yeah, yeah, fabulous research around that, and it's really good. I impart a lot of that with my training as well. So it's nice to kind of understand these resources like this to realize that when I always say, Dr. Z, you see me on shows, I'll always say food is medicine. It's not just a phrase, it's the truth. And so, you know, with that food, you're getting your medicine that way as well.
Right, but keep in mind that we can't live but 6 minutes without oxygen. So the last thing we wanted to talk about on our list of discussion topics, Dr. Redcross, is breathing.
Mhm.
So you mentioned stress before, and people reach for the prescription pad for for stress, their benzodiazepines and their other
Right.
drugs for stress, even, opioids and even cannabinoids too for stresses. But we have a free medicine called our breathing that we have that is
Mhm.
the most powerful thing for stress that's ever been looked at in
Yeah.
going back to ancient Ayurvedic medicine and probably before that, the pranayamic breathing. So again, TikTok talked about different types of breathing. Tell us a little bit about how people can breathe to help their stress.
Yeah, I'm glad, Dr. Z, you called it medicine because you're right. It's free, it's easy to get. And you like you said, we're required to breathe properly. This particular challenge, everyone, is one that focused on a certain way to breathe. It was a breathing technique, taking in a deep breath, holding it, blowing it out slowly, and taking in another deep breath. And you ask yourself, so okay, Dr. Redcross, what's wrong with that one with TikTok, Doc? And the challenge is that I love it for the mindfulness. I love it for the S management or stress management reduction. I love it for all of that. But as your doctor or physician, if you find yourself doing a lot of these breathing exercises all day, every day, and requiring that, that may need to be a phone call that you and I have as well, to try to find out a little bit of what's going on in your life. What else is going on? In other words, am I missing generalized anxiety disorder? Am I missing someone who's having a real panic disorder that's impacting their lives? So I love the breathing because, like you said, Dr. Z, that's probably the number one medicine that we all have each and every day that's given to us. But yeah, I need to know, is there anything more going on kind of under the hood that I'm missing because you're really imparting that so much each and every day that you and I need to talk a little bit more about.
Mm, yeah. So what is the box breathing that they're talking about in the TikTok hack?
Well, so the big thing is when they're talking about the box breathing, it's pretty much the way in which they're asking you to breathe as far as counting in and out. They talk a little bit about, being mindful and using those tools as you're actually taking in the breathing, but it's deliberate breathing. And you take that inhalation slowly, and once again, you hold it, and as you exhale, you're supposed to once again bring in another breath right after, which is supposed to help decrease anxiety. And it's a lot of the rhythm and the pattern that we understand, especially with you being in martial arts, understanding the importance of controlling your breathing. So it's pretty much bringing a mindfulness to the inhalations and the exhalations and making sure that you kind of put that in a little bit of a box, for you to kind of focus in there to bring that mindfulness to bear. But once again, I find that this is so valuable. I like to practice this just in and of myself before certain tasks or certain things that I do. But once again, I want to make sure that those using it, that we have a good kind of arms around them, as we talked earlier. It's a perfect way to, like as we talk about our segment completing, it's a perfect way to talk about the importance of our mental health and ways that we can manage that. Sometimes for the early stages or around it without the benzodiazepine, without some of the other things that can cause other challenges. At least until we have a discussion with our doctor to figure out a little bit more of what's going on.
Do you think mental health is stigmatized in our society?
Unfortunately, I have to answer that with the big yes. But I can also say, and I really mean this, everyone, over the probably and only this long, Dr. Z, maybe the past 2 years. I mean, I really think it's just recently that we're really starting to turn a page as a culture and as a society about it. And I think a lot of it also started with these athletes who are always in front of us, everyone, with such intense pressure to perform. And some of them started to kind of have to hit the pause button. Some of them had to kind of pull away. You're like, hold on, what do you mean? You're supposed to perform. You're supposed to be a robot, right? And they're not. They're people just like you and I. So I'm happy to say that I really and truly feel like we're turning a corner, but I think we're talking years, not decades yet, as to when we're finally starting to do that and when more people are speaking up about it. So it's going to take a while, but I'm happy about the direction we're headed at least.
Very good. Well, let's do a summary of our program here as we're winding down towards the last minutes of the Natural House Call here. If you joined us late, we've been talking over this last little over an hour with Dr. Ken Redcross. He's a medical doctor and author of Bond, the Four Cornerstones of a Lasting and Caring Relationship with Your Doctor. And he does concierge medicine, which is a really interesting medical model. It's like a holistic model within mainstream medicine, designed to enhance the doctor-patient relationship and spend quality time with patients. And he does this, and his patients include business executives, athletes, professionals, entertainment people, and people of all walks of life. And he earned his degree from Columbia Presbyterian Medical Center, but then he had other training. But then it was sort of his after medical school experiences which led him on a more holistic paradigm. And we really had a great time discussing these very important things today. So let's just talk a little bit about where medicine's going today. Do you think that we'll get to the point where concierge medicine will be a little bit more common amongst people? I mean, amongst medicine?
It's a great question because, it's, believe it or not, it's slowly turning that way somewhat. We have some groups out there who I operate alone and independently, Dr. Z, but there are certain groups that have come up to try to practice concierge medicine in the sense that sort of restricted the number of patients that the doctor has and provided a little more access to the doctor after hours and that sort of thing. So you're seeing medicine as a model trying to figure it out, some more innovative sort of companies. But, a lot of this stuff is hospital system driven, right? And so there are a lot of doctors who are maybe not as entrepreneurial and, kind of find a little more comfort with being with a larger organization. And that's okay too. But once again, in those sort of systems, it's a little bit different as far as what I like to say, the value versus the volume. But yes, I think we're slowly getting to at least more of an awareness. In 2007, when I started, no one knew what a concierge physician was. Now, a lot of people do. So once again, I think we're some time away, not years, maybe decades, way before we figure out a better way to go about it as a whole. But we're going the right direction.
In the ancient, Dr. Kamai, my business partner, and myself always talk about on our other radio show that in ancient China, the physicians were kind of hired by the family, especially on the royal side, and it was their job to keep the royal family healthy. And
Right.
by hook or by crook, they made sure that the royal family get sick, because if they got sick, that could be that
Yeah.
could mean,
could be
doctor was thrown in jail or
that
worse.
could be curtains. That could
Exactly.
be curtains.
So we don't want to get to that point, but at the same time, it's great that you're motivating people to stay healthy, which is, I think, just a great and different model of medicine. Instead of going to the doctor when you're ill and base it on, a particular ICD-9 code of illness,
Yeah.
you regularly see, so it's a combination of being a doctor and a coach. I mean, how would you
Yeah.
kind of would you expand it a little bit as we wind down the program here?
Because it's like being a doctor, a coach, and as I like to say, a member of your family. I
Yeah.
always like to say that's the way your doctor should always feel. He or she should feel like a member of your family. And so there's no better compliment than that, to make sure that all those things are married, with oneself, with that patient doctor bond.
Would you leave us with some words of wisdom, and then also how can people get in contact with you if they want more information?
Well, I think the word of wisdom, it's two things when it comes to healthcare, because I know how difficult and challenging it can be for so many of you. But those two words are, you matter. So when you remember that when you're there with your doctor, or you made your appointment, or you want to stay well, or you have questions, or you're fearful, remember those two words, you matter. And so that really, I hope, provides empowerment and inspiration for you to realize that when you get there, yeah, you deserve a little more time. Yeah, you deserve a call back to get your labs works written. You also deserve to have a plan and a plan of action and so forth when you get there. Because once again, when you see your doctor, even though your doctor is your teacher as well, this is a sharing of energy together to make sure that you stay healthy and whole. So above all, just remember that you matter.
Yeah, it's nice to have a relationship with the doctor versus the doctor as like a medical deity, where you
There you go.
kind of, you're sort of at the behold of the doctors. I mean, you're hiring a professional, so there should be that kind of relationship, but not like this hierarchical thing. It should be almost like a teamwork approach.
Exactly. That's exactly what I mean by you matter. Look, I'm no more important. It's interesting, Dr. Z. My on my business card, I have on the outside, I have Dr. Ken Redcross on my business card. And you'll see here that the DR on my business card is lowercase. And it's to show just that. This isn't about some deitization of I'm the doctor and I'm this, that, and the other. No, I am pretty much showing deference to you as well with a lowercase dr. That's pretty much saying, look, we're in this together. I have a different skill set, and we've been fortunate to get together here at this particular moment, but you're just as important. And that's why I say you matter.
Well, thank you so much for being a guest here on the Natural House Call. How can people get in contact with you if they want to send you a TikTok post
A
or,
TikTok post that we
or
could
just
talk about together. Sure. So look, my website, everyone, is drkenredcross.com. All of my social media stuff, whether it's Facebook or Instagram or even LinkedIn, it's Dr. Ken or Ken Redcross MD. And I really mean it. Please reach out. I love answering questions and meeting new people.
and that's like the Red Cross, right?
It just like the American, just like the American.
Well, make it a great day and stay healthy. And I just want to tell folks, thank you for listening to the program. And again, you can get more information about our walks and talks, myself, Dr. Z, Dr. Z Naturally, at Dr. Z Naturally website, or at drznaturally@gmail.com. We're doing our up and coming Chinatown walk October 1st, and we have a walk at Gilberti's Herbs in Westport. So you can contact them if you're interested in joining us for a day of making medicine, because we're also want to teach people the proper way to make medicines, if they want to make something that's natural from experts that have been doing this for a long time. So Make it a great day and stay healthy. Bye-bye.
Take care.